and ended up taking a job with Team Health as the assistant medical director at, and I was like 95% clinical, 5% admin. And, it was really another turning point for me. The admin part I really enjoyed. I kind of got interested in this idea of, when you're delivering care at the bedside, it's like one-to-one, right? You're seeing, you impact the life of the patient right in front of you, but you're not really impacting like the system of care, kind of what's happening more broadly. And over time, I got more and more interested in this idea of kind of the meta patient that, if you create systems, you can impact the lives of whole groups of people. And then if you create systems that are used across hospitals, you can impact, an even bigger group of people. And that led to a lot of growth and change in my career. I ended up loving the physician who founded the division of Team Health that I worked for. Totally fascinating guy who went to medical school and law school simultaneously and was just like a great mentor for me. His name was Dr. Jim George. And through Dr. George and through what was happening at Team Health, I went through a whole variety of roles and eventually became like a clinical senior vice president, which was basically a non-clinical role where I ran a portfolio of like 75 hospital relationships and was traveling around doing that. I was still doing a little bit of clinical work, but I was like 10% clinical and 90% admin. And that's when I had the next big turning point in my career. I kind of came to this conclusion that I don't really like to do things unless I can really be excellent at them. And I couldn't be excellent at clinical medicine doing it with 10% of my time. I was kind of slowly becoming, I went from taking great pride in being the person that other doctors came to when they had problems to solve to being a person who was like, just maybe not quite getting enough repetitions. And I decided to give up clinical medicine. And then my friend Rob, who was my partner in my original practice and was the chief a year ahead of me in residency, called and said, hey, Sound is going to get into emergency medicine. Would you like to come join the team? And it was a great time in my life to do that. My kids were getting older. I had less responsibility at home, and I was totally ready for a new challenge. And it was a lot of fun. I left a big, bureaucratic organization, and I went to work for what was essentially a startup inside, a bigger company, and grew the emergency medicine business from, just a couple of programs to 70 at the time that I left. And, it was fantastic. And I went to Sound as the chief medical officer.